one thing that I always tell patients having tinnitus and really disruptive, intrusive tinnitus myself is that as hard as it is right now, and I know it's hard, is that there is the hope that your brain needs to know, okay, I can fall asleep. I usually also recommend for people who have tinnitus to have some kind of tips and tricks next to their bedside table. We're using our sense of touch, we're using our sense of temperature. Again, it kind of helps get us out of tinnitus mode and thinking about how cold that was that it kind of shocked our body.
Dr. Suzanne not only works full time helping her patients with their tinnitus, but she also had a period of life where she overcame really challenging tinnitus herself. And what this means is that she has the education, the theoretical knowledge, the skills and what's needed to get her patients over the finish line, but also the firsthand experience of what it's like day to day to go through the treatment process and to go through the stages of relief and habituation. So it's my great honor to introduce Dr. Suzanne here to share with you all about her top tips for sleep. So definitely stick around.
Thank you so much, Dr. Ben. Hi, everyone. As Dr. Ben said, I am Dr. Suzanne May. I'm one of the audiologists here at Treble Health, and I'm going to share my screen with you. Today, what I'm going to do is I'm going to talk to you about tinnitus and sleep. We're going to go over some basic strategies of what you can do to help you with sleep. The first thing that we recommend here at Treble Health is if you find yourself struggling with sleep, we do recommend that you talk to your doctor first. Make sure that you don't have any medical issues that could possibly causing you sleep disturbances. Want to make sure that you maybe have a sleep study, rule out any sleep apnea, and you can also talk to your doctor about possible supplements and medications that might help you sleep better. So wanted to kind of start off with that. So one of the first things that I wanted to talk about was this kind of pattern that can happen with sleep when you have stress, normal pattern versus insomnia. On the left, you're going to see that the normal sleep pattern with stress starts off with having some stress, which results in a decrease in sleep. Your body and your brain do adapt to that stress, and this stress can also go away in a normal stressful event, and then your sleep improves. When you start developing chronic insomnia or difficulty, you're going to have stress, and in our cases, this is going to be tinnitus, which is very stressful. You're going to have decreased sleep, but what happens is our brains start to have some behaviors and beliefs about sleep change. And those behaviors and beliefs result and reinforce this hyper arousal state that we can be in and cause us to be more wakeful. And then our sleep continues to be poor. So, what I'm hoping to do is try to give you some tips and tricks today to see if we can kind of change this cycle into returning back to better sleep. So, I think the topic said 4 key points for better sleep. I think I actually have 5. I might actually have 6. And so, in general, there are 5 key points for better sleep. We want to increase our sleep drive. We want to create a bedtime routine. We want to set up our room for success. And we want to use sound therapy, especially when you have tinnitus. And you want to use some relaxation techniques. So, those are in general. We're going to go into a deeper dive one by one here. So, first, we're going to talk about sleep drive. What is sleep drive? Well, basically, it's your need for sleep. When we have been awake for a long period of time, our sleep drive tells us that it's time to sleep. As we sleep, our sleep drive actually diminishes and we become more awake. Kind of makes sense, like a teeter totter. So, in this example of the teeter totter, what we want to do is we want our sleep drive to be so big that is overtaking our wakefulness system. And so that way we can hopefully fall asleep. So, there are some things that we can do to increase our sleep drive. This is going to include having a regular wake up time. Now, this is not everyone's favorite thing. When I tell them that means having a regular wake up time means days that you are on work, also days that you are off of work. You want to try to be waking up at the same time every day. This is going to help your body get on a regular schedule and a regular cycle, and it's going to help our bodies know and our brain know, okay, this is the time to wake up and this is the time to go to sleep. Number 2 tip is exercise. Again, not everyone's favorite thing, but you can make this kind of simple. You can go for a walk, you can go for a run, you can do some push ups, maybe some sit ups. What we're trying to do is we're trying to get our body tired. We're trying to get our brain tired. And so exercise is an easy way to increase our sleep drive and make it easier to fall asleep at night. Number 3 is limiting or avoiding naps. Now, while naps can kind of perk us up, If they're short and sweet, if they're too long, they can actually make us feel sluggish and they can decrease our sleep drive. They can throw off our schedule and they can make it harder for us to fall asleep at night. So I always say try to, avoid or limit naps, or if you do need to take a nap, take something short and sweet, just enough to get you refreshed. Number 4 here would be light therapy. Now, the easiest way to get light therapy is to go outside and get some sunshine. If you are in an area where there's not a lot of sunshine, maybe you have a lot of cloud cover, there's also light therapy boxes that you can, if you Google search light therapy box, you can find lots of different options. But light therapy has shown it's basically telling our brain that it's time to be awake. It's time to be alert. And the sunshine supplies us with vitamin D. It helps our immune system and even our mental health. My only thing here is if you're going to go outside and enjoy the sunshine, just make sure to wear some sunscreen. And then, of course, last but not least on this scale here for sleep drive is melatonin. Using melatonin at night, that can actually help increase our sleep drive because it's a hormone that our brain naturally produces in response to darkness. It's going to help us regulate our internal clocks, and you can take this with a supplement. But other ways you can help increase natural melatonin in your brain is by dimming the lights at night before you go to bed, or you can even go outside and you can look up at the night sky, and that's going to produce some natural melatonin. So there are some good ways to get some melatonin going in your body, making you feel a little bit more sleepy. All right, next on our list is a routine. So to work on sleep, we need to start by building a routine. And we kind of need to start a few things during the day first. We need to stop caffeine, excessive use of caffeine. I'm not going to say get rid of caffeine because we all love our cup of coffee. I love tea, but excessive use of caffeine results in a lot of things. And you want to kind of try to decrease your amount of caffeine, especially after lunchtime, especially as it gets closer to bed. Extra caffeine has been shown to reduce total sleep time by up to 45 minutes. That's almost an hour of your time that it can reduce. Let's not have caffeine steal your sleep time. It can reduce your sleep efficiency by 7%. It can increase our sleep onset, how long it takes for us to fall asleep, by up to 9 minutes. It can increase our wake time for sleep. So we actually wake up earlier than we normally would by 12 minutes. And it can block deep sleep by 20%. So if you kind of start adding this all up, the 12 minutes that it takes to fall asleep, reduce sleep time, you're talking over an hour of time lost because of excessive use of caffeine. So one tip I can tell you, try to reduce your caffeine. As it gets closer towards the evening time, you're going to want to start dimming the light. Again, that dimming of lights is triggering our brain that we are no longer active and awake. It is triggering our brain to produce that natural melatonin. And it's telling our body, hey, it's time to switch into nighttime mode. It's time to switch into sleep mode. So dimming the lights in the house is a really good way to increase melatonin and help us know that it's time to sleep. You're also going to want to turn off your electronics. So, or use blue blocking light glasses. Electronic lights have been shown to tell our brain that we're active and awake. And we're trying to tell our brain it's time for sleep. So if we can get away from that electronic light at least 30 minutes to an hour before bedtime, you're going to be more successful in falling asleep. So now what do? You've dimmed the lights, you've turned off your electronics, but it's not quite ready for bed. You're not quite ready for bed yet. So what do? Well, I usually recommend doing some wind down activities. This could be something analog. Doing a word search, a crossword puzzle, reading a book. You can stretch, you can do deep breathing exercises, you can meditate. These are all really good ways to kind of just relax our bodies and tell us, again, our brain, we're winding down, we're getting ready for bed. And then last but not least on this routine is a normal bedtime. So just like a normal wake up time, we want to have a normal bedtime because again, we're trying to trigger our brain. This is the time we go to sleep. So for me, it's 10 o'clock at night is when I go to bed. 6 o'clock in the morning is when I wake up. I stick to that routine consistently, and that's going to be key because, again, you want your body having that circadian and you want it to be on a consistent schedule. All right, next on our list of tips and tricks is setting up our room for success. So you're going to want to keep your room on the cooler side and have it be as dark as possible. So you're going to dim any electronic lights. I can dim my alarm clock. Sometimes you might want to cover it up with a cloth. You're going to want to put up dark blackout curtains. You're going to want to set your temperature to maybe be 68. You don't want it to be too warm. When it's too warm, it's hard to sleep. So setting your room up for those few things are pretty easy to do. You also want to make sure that you have a good mattress, that you're comfortable, that you're not getting poked by any springs or any loose materials. You want to make sure that you have a very good supportive pillow for your neck and your head. And you want to make sure your blankets are comfortable. They're nice and soft, but they're also appropriate for the season. So if it's summertime, you're going to be using some cooler, lighter blankets. And if you're in the winter, you're going to be using some heavier blankets. I usually also recommend for people who have tinnitus to have some kind of tips and tricks next to their bedside table. Some of the things that I use for my tinnitus are that I have aromatherapy sticks that you can buy off of Amazon right on my bedside. So that way, if I wake up and I hear my tinnitus, I reach for the aromatherapy, I give it a little smell. My sense of smell now is now kind of engaged into whatever that scent might be. I usually have like vanilla next to my bedside, and that helps kind of distract my brain away from my tinnitus. The other thing that I have on my nightstand is my water bottle. I have a Yeti, so it keeps the water nice and cold. I have ice water. That cold sip of water is a temperature change. And so now we're using our sense of touch, we're using our sense of temperature. Again, it kind of helps get us out of tinnitus mode and thinking about how cold that was, that it kind of shocked our body. So those are some tips and tricks that I have for setting up your bed. And then another one that I don't have on here is that if you are feeling fearful of the room or you're fearful of sleep in general, one of the things I do recommend is maybe changing up your room a little bit. So moving the furniture, that it can be as extreme as that, moving the furniture, changing the color of your comforter, putting up a plant, something like that is going to help kind of make it look different. So that way, now when you come into your room, it kind of just takes your brain a second to process and takes away some of that fear response. So that's another little trick if you're feeling fearful of sleep. All right, moving on to one of my favorites, which is sound therapy. Now, in your room, when you have tinnitus, you're going to want to have sound therapy. I do recommend it. And there are, if you're a patient with us, you know that there's some kind of sound therapy rules that we ask you to kind of follow during the day. Well, at nighttime, you can kind of throw those rules right out the window because at night, we're just going to have you use a sound, anything that you want to help you sleep. We even say in the very beginning, sleep is the most important thing. So it's okay at the very beginning to go ahead if you can cover up your tinnitus, use a sound that is the most helpful for you. And there's lots of different sounds out there. One of the machines that we have available is the Sound Oasis. And the Sound Oasis is a little speaker that can sit in your room. It comes loaded with about 20 sounds. Plus, it does have an SD card that can be loaded with other sounds on it. I believe it also has Bluetooth, so you can stream from your phone. And it's quite a fun little speaker that you can have a bunch of different sounds on. Now, if the speaker is something that would disturb your significant other in the room, you can switch to the sleep headband. Now, the sleep headband does have some speakers in there, and the speakers are right, it goes right across your head. And this does Bluetooth to smartphone or a tablet, and then you can use apps or YouTube or Spotify to stream in any sound, and that's just going to be something that you hear directly. There's some great apps out there, such as Resound Tinnitus Relief, My Noise, and of course, I've got to plug the YouTube Treble Health Sound Therapy channel, which there's been a lot of work behind the scenes with Dr. Ben on that. He's got some great sounds on there for sound therapy. And another fun one is on Spotify. There is a podcast called the Sleep Pod Boring Bedtime Stories. And it's a podcast, and it's a very boring narrator telling very boring stories. So he has a very monotone voice and he tells a very boring story. And anytime I've listened to it, it's made me fall asleep pretty quickly. I can't keep my attention on it. All right. Next technique we've got is the relaxation techniques. When you're trying to go to sleep, we want to have some, or maybe you've woken up and you're trying to go back to sleep. Some relaxation techniques can help you with that. So, progressive muscle relaxation is a technique where what you do is you're going to flex a muscle group as you're taking a deep breath in through your nose, and then you're going to release that muscle group as you're breathing out through your mouth. So, for example, you're going to squeeze your toes really hard, breathe in, and then as you release your toes, you breathe out. And then maybe you're going to flex your ankle, right? And then you're going to squeeze your calves, and you're so on and so forth, working your way up your body, landing at your face and squeezing your face as tight as you can, relaxing your face as you breathe out. And it's a really good way to relax all the muscles in your body. There's also deep breathing techniques. There is a whole lot of different deep breathing techniques. I personally like one called 5 finger deep breathing, which is where you have your hand and you're basically tracing your hand. And anytime you trace your hand up, you're going to breathe in. And anytime you trace your hand down on the finger, you're breathing out. So we breathe in through our nose and then out through our mouth. And what's nice is it counts for you. It's tactile. You don't have to see what you're doing. You can do it under the covers. And it's an easy one to do to kind of help us fall asleep. When you're deep breathing, some things that happen to your body are you are decreasing your heart rate, you're decreasing your stress cortisols, you're increasing your oxygen intake, you're decrease your heart rate, and your body tells your brain I'm relaxed. And so that's just kind of another piece of the puzzle that your brain needs to know, okay, I can fall asleep. If you find that you are spinning your brain in circles, you can try counting backwards by threes. That's not one that's easy for me because I don't like math. And there is also the military method. This is where you kind of try to relax all the muscles in your body as if you are melting into the bed and you're going to think the words in your head, don't think, don't think, don't think, over and over again until you fall asleep. So, those are some relaxation techniques. And last but not least, I wanted to pull up some external resources for sleep because you may need more than what I've given here because this is a short talk. There is, and these are all ones that have been recommended by patients to me. There is the Sleep Coach School, which was developed by Daniel Erickson. He had insomnia himself, and he was able to work on it by the fear that was associated with sleep. So he worked on his fear. He has a YouTube channel, he has an app, so he has tons of resources. The Sleep Reset program was created by behavioral and sleep specialists, psychology experts from Stanford. It uses an app, plus it does have coaches. It's an 8-week program, and it's really interesting because it has you do an assessment before you start with them to kind of know what it is that your needs are that to help you with. The Sleep Science Academy was created by Devin Burke, who is a well-renowned sleep expert, and he created this 8-week. It's purely coaching program, and it really goes into the science behind insomnia, fear with sleep, and it's just a really good overall program. A lot of patients really like that one. And then last but not least is the Mayo Clinic has a CBT course. Now, that stands for Cognitive Behavioral Therapy. The I stands for insomnia. This is a free, self-paced 2 to 6 week program using cognitive behavioral therapy techniques to help with insomnia. Now, here it's a very long link. So what I'll do is I'll put it in the actual link to it in the chat. So that way, if anyone's interested in checking it out, it's a really good resource there. So that was my entire presentation on sleep. I hope that some of it was helpful.
Dr. Suzanne, were you a university professor in a past chapter of your life? Because you've got the skills and we were all fully attentive. Thank you so much.
Oh,
In addition to this topic, do you have any just general messages that you want to share here to folks who are here to get their health in check and improve their tinnitus?
so one thing that I always tell patients having tinnitus and really disruptive, intrusive tinnitus myself is that as hard as it is right now, and I know it's hard, is that there is hope. There is things that you can do to improve your tinnitus. You can get to the other side. And one of my favorite quotes is that the most biggest transformations come from the hundreds of tiny imperceptible steps we take along the way. And so that is the journey of tinnitus is you take all these tiny steps and at the end you're able to look back and go, wow, I did that. So you guys can do it. I know you can.